So, Dr. Gordon, I got a question. It's so common that you look at people of the Far East, and they commonly have been wearing face masks for decades, but not here in the U.S. And as a result of this pandemic, it's almost become a global standard. So, what do you think will be the role of masking and other mitigation factors looking forward, particularly if there is a recrudescence in the fall this year and/or in subsequent years?
Good question. Masking is proven to be extremely effective. The issue for a lot of folks are concerned about mixed messages. And I think early on, the instructions to go and not use masks was in large part brought about by the lack or the understanding that we had limited amounts of masks, and wanting to make sure that the people in the hospital would be able to have access to them because they had higher exposure to COVID. But the fact of the matter is that masks are effective, masks are safe, and masks are cheap, and now masks are available. Influenza this year, virtually non-existent. We were very concerned about co-infection of influenza, which kills 30 to 50,000 people in the United States every year. Okay, we were concerned that influenza plus COVID was going to be that much worse, and we saw virtually no influenza this year. And most healthcare professionals were really convinced that masking and social distancing had a huge amount to do with that. Although the CDC did significantly liberalize recommendations for mask wearing, for example, the most recent and end of last month said immunized people don't need to wear masks indoors, even in large gatherings. This is met with a lot of criticism in the medical community. And I think that you need to think carefully about wearing masks based on your own particular situation and your own particular risks, and also the people that you're going to be mixing with. So if you're in a group of people where everybody's been vaccinated and otherwise fairly healthy, then I would agree with those recommendations. But if you're going to go and be mixing with a group of people that may not respond to the vaccine as well, elderly individuals, patients that have underlying immune compromise, patients on biologics like you were referring to earlier that might compromise their immune response, those people would be at increased risk for the virus exposure, and then it's increased risk for picking it up and getting more severe disease. And you potentially could transmit it to them even though you have no symptoms. We know that a good 50% of people who acquire COVID have no symptoms. So it's really important to note that even though the vaccine does provide a great degree of protection, it's not 100%. It's 95% for developing disease. And early on, the early studies showed that it was nearly 100% protective in protecting you from dying, which is really the important thing. We want to go and we want to avoid hospitalizations. We want to avoid people dying. If this became a situation where you got sick with an upper respiratory infection, stayed home for a few days, and we're fine, it wouldn't be nearly as big a problem. The problem is right now also we have these circulating variants we talked about a little bit earlier, where these strains are a little bit different. They're much more contagious potentially, and some of them are potentially more serious, so they make people ill. This last surge, we were seeing a lot more young people getting sick, people in their 30s and 40s who didn't have a huge amount of great risk factors. So although I will say that the people in my personal experience who I did see like that, none of them had gotten the vaccine. So I think that we need to be very careful about masks and not discard them too quickly and use them appropriately when they meet our needs. Me personally, I don't feel comfortable going into a crowded restaurant yet. I don't feel comfortable going into a crowded movie theater with people that are mixed, with people who are vaccinated and not vaccinated. So going forward, it's really going to be based on what the prevalence is of disease in the community. If we get to a point where the positivity rate is 1% and there's very little disease, then people will certainly feel, and the vaccination rate's extremely high, then we're going to feel great about wearing no masks. But when we get a surge again, and certainly there's concern that may happen in the fall when everybody goes back to school and people are in closer proximity to one another, then I think that there's going to be a role for masks, and I think we need to be willing to wear them when we need to.